One of the things that we're very keen to do is to ensure that there is some social innovation and that there is an opportunity for the community sector to actually assist the community and the department in coming up with the answers around how we demand manage, what are the services that we're required for the population in the future. We know that the population is ageing. We know that there's an increasing demand for services across all portfolios, again ranging from drug and alcohol to mental health to cancer services, etc. So with an increasing ageing population, there's likely to be ongoing increasing demand for services. But we are restricted in the amount of resources that we've got available to meet all those demands. And so we need to know, we need to establish the most efficient and effective way to deliver services. We can only do that in partnership. And so the government's focus now will be on the policy, on the planning, on providing the funding sources, ensuring safety and quality are critical components, and I guess providing some regulation around the delivery of the services. It's just a matter of saying, we provide this funding for you to deliver this service. And so it's as simple as that. I think the thing that we also need to be mindful of is the introduction of key performance indicators. And the key performance indicator is a measure of activity or productivity against the expected outcome that we are funding. We also need to be accountable to the taxpayer. And so if we are clear about what it is that we're funding, we can also inform the community around these are the services that the Department of Health and Human Services is purchasing because the population need lies in this area. We need to build capacity now. We need to start that process so that when we get to 2020, in fact, we've got the services available. We can only do that in partnership. Again, the burden of disease, the demand for services cannot be met by one single agency alone. We will need the assistance and the partnerships of a broad range of agencies, and the community sector is critical to the delivery of those services. The strategic plan provides if you like, a roadmap to the future over the next 3 years at least. We see that the strategic plan actually provides a level of accountability. It provides transparency for the community about what the department's goals and objectives are. But as part of that funding program is an opportunity for the community sector to be innovative. And I think one of the things that we want to be clear about is that there is an increasing demand for services. We are going to see that increase again as we move towards 2020. And we have to be really cluey about and clever about how we actually deliver those programs. So again, we'll work in partnership. We've got a range of architecture to put in place, but most importantly, we want to work in partnership so we can answer some of those critical questions as we move forward.